Local anesthetics are drugs which interfere with impulse conduction in nerve reversibly. The ideal local anesthetic should be water-soluble, stable in solution, non-irritant, low toxicity, rapid onset and long duration, potent, low cost, not addictive, not allergic, does not produce permanent damage to nerves or tissues. Local anesthetic in general is formed of lipophilic group, usually benzene ring, and hydrophilic group, usually tertiary amine. They are connected by intermediate chain, which include ester bond or amide bond. So they are classified into either esters or amides. They are weak base drugs. So in acidic medium, they will be ionized. In alkali medium, they will be ionized. They are available in the form of salts to increase solubility and stability. pKa of most of local anesthetics is in the range of 8 to 9. So according to Henderson-Hasselbalch equation, in alkaline medium, they will be non-ionized. In acidic medium, they will be ionized. Amide group includes lidocaine or lignocaine, bupivacaine, brilocaine, ropivacaine, and articaine. Ester group include cocaine, procaine, tetracaine, and benzocaine. Cocaine is rarely used due to addiction, and it is the only local anesthetic which is used alone without adrenaline. Procaine is not effective for surface anesthesia or topical anesthesia. And benzocaine. Fate of local anesthetics. Most of esters are metabolized by pseudocholinesterase, while amides are metabolized by liposomal enzymes, mainly liver. This can be a factor in choosing agent in patients with liver failure. So in patients with liver impairment, esters are preferred than amides. Articaine is amide, but it contains an additional ester group, which is metabolized by esterase enzyme in blood and tissue. Half-life is about 20 minutes. Because it is hydrolyzed very quickly in blood, risk of systemic toxicity is the least with other local anesthetics, especially if repeated injection is performed. It is used in dentistry for infiltration and block injection. Local anesthetics are used either for surface anesthesia. Procaine is not effective as a surface anesthetic. Infiltration anesthesia, peripheral nerve block, plexus anesthesia, epidural anesthesia, and spinal anesthesia. Mechanism of action. Local anesthetics act by inhibiting sodium influx by blocking sodium channels, so they are called membrane stabilizers. They block voltage-gated sodium channels, so interfere with sodium influx, and so action potential cannot arise and conduction is inhibited. They act from inner side of membrane, so they should enter inside nerve and then block sodium channels from inner side, not from outer surface. Because local anesthetics act from inner side of membrane, they have to enter inside nerve to block sodium channels from inner side. This will be more if it is non-ionized, and this will be in the alkaline or pH is increased in alkaline medium because they are weak bases. In inflammation, medium will be acidic, so local anesthetic will be more ionized, and so it cannot penetrate across cell membrane. So injection of local anesthetic in inflamed area is not effective. If pH is decreased, local action of local anesthetic is decreased, and if pH is increased, the action is increased. Because most of local anesthetics produce vasodilatation, so usually adrenaline is added with local anesthetic to produce vasoconstriction, decrease absorption of local anesthetic, decrease toxicity, and decrease bleeding. Cocaine is the only local anesthetic which does not produce vasodilatation. It produces vasoconstriction because it inhibits uptake 1. So there is no need to give adrenaline with cocaine, but usually with other anesthetics, we give adrenaline to prolong their duration. Sequence of affection. Local anesthetic affect nerves according to their diameter and myelination. The most sensitive are sympathetic nerves. They are myelinated. Then sensation, pain, cold sensation, temperature, touch and pressure, and lastly, motor nerves are affected. They affect myelinated before unmyelinated nerves. Side effects of local anesthetics. We have localized side effects and systemic or general side effects. Localized side effects include numbness, paraplegia, chest tingling and feeling of pins and needles, or strange sensation, and nerve damage may occur if injected in nerve. General side effects. Toxicity usually occurs at plasma levels which are rarely reached if proper anesthetic techniques are used. They include central nervous system. Toxicity include initial symptoms, excitation, ringing in ears, tinnitus, metallic taste in mouth, tingling or numbness of mouth. As concentration is increased, advanced symptoms appear in the form of motor twitching, then seizure, convulsions. High concentration may lead to coma and respiratory arrest and failure. Cardiac toxicity associated with overdose of intravascular injection. If it reaches circulation or it reaches blood in high dose, it will produce hypotension, decreased conduction between auricle and ventricle, and cardiovascular collapse. Hypersensitivity or allergic reaction to local anesthetic, especially ester group. Esters are more liable to produce allergy than amides. So amides are preferred as alternative in this patient. There is no cross allergy between esters and amides. Methemoglobinemia, conversion of ferrous of hemoglobin into ferric, leading to cyanosis and hypoxia. Benzocaine, lidocaine, and prilocaine can produce this effect. Especially benzocaine is the most liable to produce this side effect. Contraindications of local anesthetics. They are contraindicated in advanced liver disease, especially amide group. Application to damaged skin or application in middle ear, they may cause ototoxicity. Injection in infected tissue or inflamed tissue, they are non-effective. Hypersensitivity or allergic reaction, which is more common with esters than amides. Heart block. Usually, adrenaline is added with local anesthetic to prolong their duration, but in patients in whom adrenaline is contraindicated or dangerous, we give local anesthetic without adrenaline. For example, in hypertensive patient, in patients with arrhythmia, thyrotoxic patient, cardiac patient with angina or infarction, we use local anesthetic without adrenaline.